Hi, my name is Kathleen Listen. I'm a certified lymphedema therapist and board certified massage therapist. I have a practice in San Diego, California. And this is my video for people who are over 3 weeks out from their liposuction or Brazilian butt lift surgery, and they're looking for a little help with self-massage tutorial, what to do in between your lymphatic massage visits. Particularly if you're starting to feel lumps, bumps, fibrosis form. So this will kind of be some ideas to do for your massage at home. The oil I use is jojoba oil, and then I'll also show you if you have cupping. If you have cups, we'll look at a little bit of few techniques for lymphatic massage cupping, as well as some hands-on techniques that you can do for yourself. So what I would like before the massage is go ahead and warm the skin. So what I do in the studio is I will use hot cups, hot stones to warm the skin. If you don't have hot stones, you can either do some nice cardiovascular exercise, like go for a walk. If you're able to exercise, go for a run. If you can't do that, you can do some stretching or exercises that will tone the core, and that will warm those muscles up, which will warm the skin. And if you can't do any exercise at all, go ahead and take a hot shower. And just having that hot water it'll make the massage easier. It'll make getting in to really work in that lumps and bumps less painful, so we can do more work. So you can do this several times a day if you want, 5 to 10 minutes for each session of massage. And then after the warming, you can do 5 to 10 minutes of massage. When I would stop is when you're seeing any redness in the skin, like a hickey is going to form. We don't want that, and we also don't want petechiae, which is a tiny little red pinprick dot. And petechiae means that we're breaking capillaries under the skin, and we don't want to do that because we're still trying to heal. So I'm going to tip the camera down and just show you a few ideas for how you can massage yourself. Okay, so I have my stomach exposed. We're going to add some jojoba oil to it just to get the skin used to your touch. And then what I would say also is when you're touching yourself, when you're giving yourself a massage, make sure you're in the right, you're saying the right things to yourself emotionally. This is not something you're scared of. You don't think you look ugly. When you're going to touch yourself in this area, you accept yourself. You are making yourself more beautiful. And you're healing. This is a healing massage. So just don't come at yourself like, no pain, no gain. Let's do this all at once. Make it a nice, gentle experience for your lived-in body. So we're going to focus on a few different tricks. And one of the tricks is tightness, making the skin taut. So you see how if I lift it up here, it's more taut here. If I bend over, see how I'm taking any of the wrinkles out of the skin. I'm making it very tight in this area. So we're looking for tightness. When we're going in fibrosis, we want to make sure that we have skin tightness, that it is taut. So we're going to do tautness, and then we're going to practice a little bit with twisting and see if that can't really help us. So we've applied the lotion, and then what we're going to do, so generally if you have liposuction, if you had a Brazilian butt lift, you do not have abdominoplasty, so you don't have any big scars. The lymph flow is going to go down to the inguinal ligament, the lymph nodes right here. So we're going to push in, and this would be over if we're wearing underwear. You can kind of feel your underwear here. It's right at the point where the body meets the leg. We're going to scoop up and in. We're thinking like we're going to scoop something into the belly button. So on either side, this is how, by scooping up and in, we're going to clear out those lymph nodes and let some of this swelling go in. And then we're going to start just, this is gentle, it's more just the idea of it. See how I'm pushing the skin down. Pushing the skin down. This is not proper lymphatic drainage. If you come into my office, I don't do this at all. This is not going to really move a lot of edema, but what I want to do is get the hands on the skin, moving it around, and as you're moving it taut, feeling the skin, feel where you want to work today. Where is the lumps and bumps? Where is that lump or that bump? We're kind of pushing our way, we're feeling through the skin. Where are we going to work today? So often I'll see a lot, fibrosis can start down here. I can feel a thickening, can really go anywhere around the belly button. I can feel it, and then really on the sides. We can really feel fibrosis on the sides. So feel where you want to work today, kind of get the idea of where you want to work. If you have any kind of issues with toileting, going to the bathroom if you're a little constipated, moving up, moving a massage up and across. We're kind of tracing the large intestine, the path of the large intestine here. So this massage can be good. This type of massage can be good in the morning. Also drinking a hot cup of water in the morning can really help. Doing a little massage. Definitely if you want to add some essential oils to your lotion, you've only had liposuction, it's over 3 weeks after liposuction, that should be fine. To a palm full of lotion or oil to add 1 or 2 drops of essential oil. Whichever one that you like is great. Geranium might be a good idea if you're looking to reduce edema. You can also look into any of the citrus fruits. Essential oils might be helpful. Okay, so that's good if we're looking for digestive help. Now let's look into do a deeper exploration. So we're going to start by the belly button. See how I'm making little circles, and then I'm going clockwise or counterclockwise around the belly button. And as I'm moving, I'm doing these little circles, and then I'm moving out. So I'm kind of going to move out and out and out. So that's my main direction. And each time I'm doing little circles. So say I feel something, I feel like a lump here. Just do your little circles a little bit more. Figure out, so if there is a fictional lump here, as you're doing a circle, part of the circle should feel really easy, and then part of the circle, and it's for each lump it's a different, so it's not always this direction, but one direction that you're going in, it should feel a little bit more difficult, like you have to dredge through something thicker, some kind of mud to get in that direction. So that's the direction that you want to kind of push, and then just keep on moving. So we can't get rid of a lump instantly. What we're doing is loosening it up. And then if we're doing this massage regularly, we're regularly working on each of these things for a few minutes each day. Eventually, with our compression, the whole thing is going to work to help loosen that fibrosis up. Again, if we find something, we're gonna lean back, we're gonna pull the skin up so we get that tautness of the skin, tightness of the skin. And then we can go all the way around with these little circles all the way around. So that's the basic idea, and you can really get into some really good, depending on what your surgeon did, there can be swelling here, swelling on top of the ribs, to some fibrosis on top of the ribs, that you can really help with these little circles, I got this idea for the little circles. It's a type of Chinese massage called Qine Sang. They have this type of abdominal massage where it's little circles all around. Okay, so you've done all your circles. Now let's look at the side. So this, we can have a lot of fibrosis on the side here. So what I want to do is we want to see how much can we lean. So we want to have this tightness of the skin here. We don't want to have like a lot of extra skin, because if we have like extra skin here and we're trying to move around, like how are we really affecting anything? We want the skin to be tight here, very taut. And then with the other hand, pulling through it. Seeing a lot of times I'll get a lot of tightness right here. So we can really get in, massage that area, see if we can change it a little bit. It's hard. This is nothing that you can do that will be the equivalent to someone else doing it for you, someone with a lot of training. But you can try to get, and then along the ribs, you can even get your fingers in between the ribs, underneath that rib cage. So that, and then along on the other side, kind of really try to grab and drag through anything you can feel. And we're stretching along the side, stretching as much as we can, and then dragging through. Okay, so that's good for the massage. So now we'll try with the cups. So you want to make sure, get a little bit of lotion on the lip of the cup, and then you want to put it, you don't need it too suction-y. So you want to get some level of suction, but not too much, because I have to be able to move it around. So see how I'm bending back and I'm moving this around. I'm stretching out and I'm moving this cup around. So if we wanted to move it in a certain direction, we can start at the top, move our way down. If we find that piece of fibrosis again, we're gonna make the skin taut right here, and then we can use massage all around. We're kind of scooping out from all directions, scooping out. If you have 2 cups, if you get that set of cups, you can put 2 cups together. Is the fibrosis right here? Put a cup on either side of the fibrosis. Move those cups around. Pull them away from each other. Move them back and forth. And then this twisting part. Can we twist the cup and see how the skin is twisting around the cup? So we're tight, because the cup is sucking, and then we're twisting. So usually you'll need a little bit less of a oil on the skin to really get that good twist. So you might need to put it on dry skin. Then you can see the twisting, you can see like the lines right there. So you can do a little bit of twisting with the cup on drier skin. Or again, you can do just the massage here. So this is on the taut skin. So the next level, the next idea, the next concept is to move what's underneath. So move the body. And the cup is here, and we're moving the body. So I'm stretching and then crunching. Stretching and then crunching. So is the fibrosis here? You're putting the cup on the fibrosis, stretching, crunching. So see how the body is moving underneath that cup. and you'll feel it. If it is fibrosis, when you stretch, you'll feel a real good stretch right there. You'll feel like something's moving when you do that. So what can we do if it's on the abdomen? Take a deep breath in, breathe out. Deep breath in, breathe out. And even if you want to move the cup, take a deep breath in, breathe out, and push that cup down. Deep breath in, push out, and push that cup in. So practice with the deep belly breathing and then really contracting the abdominals afterwards. Practice on the side. If you have the side fibrosis, you can do a twist, you can do a stretch. Anything that you see, pretty much, if you're cleared for exercise, on those standing ab videos, do the standing ab video with that cup over the fibrosis, and then practice some of those moves and see if that really helps you. Again, we're looking for 5 to 10 minutes max, and we're looking for, you saw when I took the cup off, it was a little bit red, but then within 30 seconds, within a minute, it's not really red anymore. It's not gonna bruise, it's not gonna look like a hickey. And then at the end of it, we're just gonna kind of smooth everything down. We want you to wear a tank top underneath your faja, so you can leave a light coating of this on. If it's a good oil, if it's a nice oil or lotion that you're using, because we want the skin to be, we want the skin to be healthy. We don't want it to be dry, because if it's dry, if you're itchy now, you're going to be real itchy with dry skin as well. So just remember to put the tank top over it, and make sure all this oil is absorbed into the skin, so there's no oil that gets onto the garment. If you wanted to, you could take a hot washcloth with some hot water on it, hot moist washcloth, in the beginning and at the end, to take off some of the oil and just to bring some blood flow to the skin with that nice hot washcloth, and just to make you feel a little bit better. If you've had a really good cupping session, I usually tell my clients it feels like you did an ab workout, like you feel a little sore here, because we were doing some stretching and crunching, and the cupping was, grabbing the muscles and stuff. So that's completely normal. Don't go to the point of pain, because what we don't want you to do is take NSAIDs. If you have to take any pain pills, let it be acetaminophen, but don't take non-steroidal anti-inflammatory drugs.